prostate cancer or BPH. What are they supposed to know now? Because
Any summary, but the summary of our presentation this morning about cervical cancers are that they are sexually transmitted. That is key. And anybody that is sexually active has to go for that test. Go for pap smear, so that early detection meaning early cure. So once we detect that early, the treatment is 100%, the cure is 100%. So late detection will lead to other complications that may come. And one key thing that Professor Amaka said was that discussion about, creating more awareness about those cancers makes it even better for people to open up and talk about it. You know, it's not easy to talk about it. She gave an example of a woman, a 60-year-old woman who started bleeding but could not share to her children that after she has stopped menstruating and now she's menstruating again. Those are trivial issues that you cannot talk about. So when we create awareness, both for the men and the women, and for the men, when you have sex with your wives and you see blood, at least raise an alarm. And I know of a family, of a friend, that it was her husband that dictated that she has a breast cancer. Because he said the breast is abnormal. You know, the men used to use the breast to either suck or during sex. So he was the one to tell the wife that, no, your breast is abnormal, or it's not as I know it before. So even if you don't know yourself, the husband, that's why I'm talking about it now, so that the men can also help the women. And when the woman is having pain, you know, during sexual intercourse, and she tells you, raise an alarm so that you can go for counseling. Thank you very much.
Good morning, church. On the side of the men, God helping us, we adequately address the issue of prostate cancer. And our speaker was able to first tell us what cancer generally is. That it means abnormal cells in the body that tends to respond autonomous to normal regulative body orders. And we have millions of cells in our various parts of the body, e.g. the heart, the liver, kidney, etc. That prostate is a normal male human organ that every man has it, and is hidden below the bladder. So it's part of the reproductive organ of the male, and that it is about the size of a medium kola nut, and it enlarges with old age. Instead of growing old and it's reducing, constricting, it enlarges. And that prostate cancer is common. And in Jude here, close to us here, 3 to 6 people weekly, they diagnose it. Yeah. Then who is at risk? He said old people above 50 years. Chronic smokers are also, and alcoholics are at risk of contacting these prostate cancers. And then those who have family-related history of cancers are also at risk. Signs and symptoms. He said frequent peeing or urination, and you cannot hold it. It's a sign. Like we're here in a meeting, before you know, every 30 minutes, you are going out to, Oga is going out to pee. And, but the care should be taken not to mistake it from diabetics. So he said urine not flowing out well and powerfully is another sign too. Then he said also the issue of retained urine. Some try to push, but they can't urinate. And then complete blockage at some instance that require emergency care to pay well for urinating. Then passing, he talked about passing urine with blood, swelling of face and legs, and cannot be able to walk well at all. We look at remedy. He said go and see a doctor to assess the signs and symptoms. Then the examination is to differentiate or rule out other possibilities. Is it diabetic or cancer due to frequent urination? It's one of them. Then how to confirm prostate cancer? He says it's through biopsy. And what is biopsy? He says he's just taking a small piece from the prostate to the lab to confirm whether it is prostate cancer or not. Okay? Then he said there are stages of the cancer. It's very important, the stages. He said whether it is within the prostate, the tumor is there localized, or without, outside the prostate, and then the aggressiveness. He was talking of how some of them are properly, they will localize in one place, they will not scatter, and then they will know how to handle it. Remedy. The cure for it is that there is total removal of the prostate through operation at the early stage, that is surgery. Then medications are also given based on the age or aggressiveness when early discoveries are made. Then he talked of radiotherapy is also employed. Prevention measures. We say prevention is better than treatment or cure in medicine, isn't it? He said we can prevent this through exercise. And exercise is any exercise that is convenient for you, whether it's jogging or playing table tennis or lawn tennis or whatever in the house. Healthy lifestyle, healthy diet, and then lowering of loss of weight. We should avoid obesity. Then going for regular screening, especially for those that are more than 50 years, can come for medical screening annually through blood tests and examination. And those who have family-related history of cancer can come for early screening at the age of 45 years. Don't wait until you are 50 for early detection and adequate care and treatment. And finally, we entertained several questions and answers were addressed adequately. Thank you.
It's another sermon again, right? Thank you for that summary. He was listening and writing down things. Thank you very much for those summaries. So if there are questions that we would like to take together, we will. I think that also goes ahead to answer what some women wanted to know about breast cancer, about prostate cancer, because he gave a more detailed summary. So I think that has captured that. So are there specific questions that we need to address together now? If you are, this is why you may have to raise your hand so that we save time. Yes. Okay.
So now I'm enlightened.
Yes.
Is there a way, as the woman of the house, to know that the man may have that? Is there anything I can do? Like she gave a story of the man knowing that the wife's breast was not. So is there a way physically for a woman to know?
Okay. So Dr. Shaibu will address that. He has noted your question already. If there is a way, because there are certain things you say we can't do something about. Like I'm already a man, I have prostate. I can't become a woman now. So I'm sure he will address it.
For prevention of such cancers, especially like the men, are there things we can eat or improve in our diets to also help in the prevention of these cancers? Maybe we need to emphasize that.
Okay. With respect, Dr. Shaibu will address that. He talks about some diets there, so maybe he will emphasize it again. Any other question? Why are we not asking questions on cervical cancer? Everything is prostate.
I will ask.
So I also want Dr. Shaibu, I'm telling him now, he's telling me that I'm holy. So I want to, please, how does prostate cancer affect sexual activity? Because that's how it will affect us, the women. So does it affect sexual activity, whatever?
Okay. Thank you
that's
very much.
That's what I want you to tell us.
Thank you very much. I think we'll stop women from asking for some time. Let's men act now. Let's balance. If they will say gender equality, this one is now the other way around. So can we have men now? Let's hold women down. Okay.
We are helping our weaknesses. We are weak in asking questions. Amaka will also help us to address some questions are there some additional things that men need to know about cervical cancer? Specifically, after treatment of some cervical cancer like hysterectomy or some cone biopsy, does it affect sexual activity?
Okay. Thank you very much. At least you saved us more. So I think we can start with those ones so that we can round off. Dr. Shai.
All right, thank you for the questions. Is there anything that the wife can do to help detect it early, all right? I think that's the question, if I get you. Yes and no. No, because unlike the breast that is superficial and visible, the prostate is not visible. So to that extent, there's nothing you can do. But as we said, the symptoms are very common and relate to urination. So if you notice that the man is going out too frequently to urinate, or he goes, instead of the normal 2 minutes, he stays there for 10 minutes, waiting for the urine to flow, then there is a problem. And that you can help to address, at least refer him, or encourage him to present quite early. The issue of diet, I think, was the next question. Diet is helpful in the sense that generally, very healthy diet, vegetables, whatever, generally reduce the risk for cancers almost everywhere, not purely for prostate cancer. So yes, it's good to maintain a healthy lifestyle. As we said, exercise, good diet, adequate nutrition, very important to reduce generally the risks for prostate cancer. I'm not sure if there was any particular diet. I know there are diets all over the place, excuse me, but I don't think there's any evidence to say a particular type of diet helps more than the other. Then Professor Ocheke's question. So the presence of prostate cancer affects sexual function in different ways. If it is there before treatment and it's a little bit advanced, it can affect sexual function in the sense that in the anatomy, that's the way God made it, the prostate gland is very close to some particular nerves that help a man have very good erection. So if the cancer affects those nerves, it's very likely that it impairs the sexual function. Also, the treatment types that are given, whether it's the drugs or the radiotherapy or even surgery, all of them have a significant impact in reducing the quality of the erectile function of the man. So before diagnosis, after diagnosis and treatment, all of it can affect the sexual function of a man. But the good news, as we said, is that there are things that can be done. So if after the treatment, the sexual function is poor, then there are medications that can be given, there are other surgeries that can be done. So it's not a hopeless situation. I think that's I don't know if that helps to address some of the questions. Okay, I'm looking at them. All right, I think those are the questions. Thank you.
Okay, sexual function following treatment for cervical cancer. We know that sexual activity usually will start in the brain. That's the biggest sex organ, your brain. So for many people, the problem is mindset. However, people following treatment for cervical cancer, oh my goodness, sorry. People following treatment for cervical cancer, people have complained of dryness, decreased interest, reduced libido, decreased interest in sexual function, and sometimes some pain during sexual intercourse. A lot of it usually may not be organic. That is, you can't see, when you examine, you can't see why you are having this. Many times it is just something of the mind. Because like a lot of people, when they have certain illnesses, certain diseases, and you've had surgery, you've had treatments, you may feel in your mind unattractive. And then you may also be disinterested, like somebody is trying to be alive and you're talking sex. I beg, let us discuss something else. That's not my problem right now. Now, when person they alive, you go to talk that one. So please leave me alone. So most of it is psychological. But sometimes you may have some reduction in vaginal capacity from radiotherapy and all that. There's some dryness following radiotherapy, so you may need lubricants. But for whatever the problem may be, there's a solution. And sexual activity can still continue despite the fact that you've had a total abdominal hysterectomy, you've had radiotherapy, you've had chemotherapy. But as we had said earlier, please don't keep it to yourself. If you have any of these challenges, when you go for follow-up with your doctors, please raise it, that this is the problem I'm having, and they'll be able to advise accordingly. Based on whatever it is. And for the husbands whose wives have this kind of problem, please also be patient and accommodating and be willing to talk about it. Because sometimes discussing about it is even already the solution to the problem. Right? So please, let's be patient. Let's encourage one another. Let's be there for one another. The vow we took is in sickness and in health till death do us part. Thank you.
So there's men are working. So we take 2 more from men, and then.
Yes. From yesterday, we've talked about cancer of the breast, and then today, prostate, and then the cervix. So my question is this: what is the place of alternative treatment? And these alternative treatment, they come in different shapes, color, and sizes. So there is no particular alternative treatment that I'm talking about here. But I'm sure you are aware that there has been a lot of peddling about the effectiveness of alternative treatment. So what would you recommend, both of you, about alternative treatment in these conditions?
We'll take the second question right away, so that.
In fact, my first question is related to that. Because since yesterday, the question is being asked, and it seems our facilitators are shying away from saying something. We've asked, people talk about alternative something. What you say, science, what is it? Let's be open to ourselves. I think we've been going around it, Hallelujah Diet. What is Hallelujah Diet? We've even given them Christian names that make them look as if they are efficacious. Yes, sir. Let's strip these things of all those things, and let's talk to ourselves sincerely, so that we don't get carried away with all these things about alternative medicine. Then out of curiosity, this might not add anything to us, but I'm just wondering, they said we were told that these cells, they misbehave and they go to other areas. So if, for example, a prostate cell now misbehaves and goes to the liver, does it become liver cancer, or is it still prostate cancer in liver, or what is it?
Thank you very much. Those are 2 interesting questions. So we will take time now. Just like I said, the swords are there. Now we are going to use the 3 swords so that we can dissect this properly. So I think our speakers again will be coming out stage, the issue of alternative medicine, and then the second question asked by Uncle Nat.
Okay, thank you for the question. I'm sure for all of, or most of us medical practitioners, time will fail us to tell stories of the patients that we know or were managing who left our services and went for alternative medicine and then came back with diseases that are far much more worse than what they initially had before the treatment. So alternative medicine, as far as we are concerned, is a no-no. Number one, you don't know what they are giving, or even when you don't know, I mean, they don't understand how the disease is. If you don't know who your enemy is, how do you attempt to manage or to treat such such an enemy. They don't understand what the disease is. So how are you certain of what you are given is the proper treatment for the disease? So alternative medicine, as far as we are concerned, is a no-no. It's not scientifically proven, whatever it is. So I think that would do. We can tell a lot of stories. People come, they have this, then they vanish. It's prayer house, it's hallelujah diet, as you are saying, or is some supplements that you can't explain, or stem cell, they say they come with it. And then months down the line, this disease has progressed. It's far aggressive. It's at a stage where you can't do anything. And then they are back in the hospital. And there's nothing you can do at that stage. I think part of the problem is, I don't know whether it's the mindset, just as you were saying, and then also sometimes poverty, because sometimes they may not be even cheap, or maybe accessibility. But I think at the bottom line would be the mindset of our people, and the distrust maybe for.
It erodes our chances of catching the cancers early. Every cancer, if you can catch early, there's room for cure. The time the patients